Hello everyone. In this session, I am going to discuss acute inflammation. So I am going to discuss vascular events of acute inflammation. In this session, there is a separate video on cellular events of acute inflammation. So I request all the dear students to watch the two videos together so that you will have a complete understanding of the acute inflammation, all the events. So let's start it. Before coming on the various vascular events, let me tell you what is inflammation. Let's define inflammation. What is inflammation? Can you define inflammation for me? Now, there are four types of microbes: the bacteria, the viruses, the fungus, and the parasites. They all enter human body and cause infection in human body. So, whatever the harmful effect caused by the microbes in human body is known as infection. But the defense mechanism by the human body against the infection is known as inflammation. So inflammation is a defensive mechanism, So whatever the harmful effects caused by the microbe is infection, but the defensive mechanism by the body's immune system is known as inflammation. So inflammation is the local response of the living mammalian tissue to injury of any agent. That is the definition. So you can see what is infection, what is inflammation. So whenever any microbe, the bacteria, the virus, the fungus, or the parasite enters human body and cause the ill effects, it's infection. But the protective phenomenon by the body to a variety of the agents is known as inflammation. So can I say that inflammation is the body's defense mechanism? Yes. So you can say it's like the army. There is a country, all the countries have army. So whenever any foreign element, the harmful foreign element, that is the terrorist, get enter in the country, the army get activated. Now there is a fight goes on between the terrorist and the army. If the terrorist win, infection occurs. If the army wins, inflammation occurs. And the fight between them is known as phagocytosis. So same mechanism occurs in human body. So we will understand the various events of various vascular events of inflammation in the form of a story only. Okay. So who is the army? The army is the WBC. WBC known as leukocytes. This is the army which is providing the defense mechanism and which is responsible for inflammation. So that is the thing. Now, how many types of inflammation are there? There are two types of inflammation: the acute inflammation and the chronic inflammation. Acute inflammation and chronic inflammation. To understand it, let's take an example. So the best example of acute inflammation is tonsillitis. We all have tonsillitis. I guess everyone have experienced some episode of tonsillitis from their childhood. It's very common, right? And the best example of chronic inflammation is TB. You can see TB. Now, both of them are caused by bacteria. The tonsillitis, let me write, tonsillitis is caused by a bacteria, most commonly the Streptococcus pyogenes. And tuberculosis is caused by the bacteria. We all know Mycobacterium tuberculosis. Now, what is the difference between them? One is acute, one is chronic. What is the difference? So the onset is different. Here the bacteria enters human body, enters the tonsil, and immediately after entering, within hours, the symptoms will come. Here the Mycobacterium tuberculosis enters human body, goes in the lung or other organs. It will remain dormant for many months or many years. Now when the immunity will drop, at that time the symptoms will come. So symptoms presents after months or years. So here onset is very fast. Here onset is slow. So the first point is the onset. Onset is the time between the entry of the infectious organism in human body till the first symptom presents. This is known as onset. So onset is different. You can see one is rapid onset, one is late onset. Now the second is the duration. In one, the duration is short. In one, the duration is long. If we have tonsillitis, it lasts for say a week, maximum a week, 4 or 5 days if we take the treatment. If even we don't take the treatment, it can be a week, not more than that. But if TB occurs, even with treatment, the shortest duration of treatment is 6 months. And without treatment, it can be for years. So the duration of the disease is short in acute and long in chronic, right? Now, what is the hallmark? Whenever there is the acute inflammation, whenever in any organ of body, the hallmark feature is the edema. Edema always occurs. And whenever there is the chronic inflammation in any part of the body, the hallmark feature is the granuloma. So granuloma is the hallmark of the chronic inflammation. Here edema is the hallmark. Now name the main cells which are involved in acute and chronic inflammation. In acute inflammation, the main cells involved are neutrophil. And in chronic inflammation, the main cells involved are the macrophages. So that is the difference between them: the acute inflammation and the chronic inflammation. Now here in this session, I'm going to discuss the acute inflammation. Even we divide the acute inflammation into two parts, the vascular events and cellular events. So we will be discussing the vascular events in this session, in this video. Okay, so before coming on the events, let me tell you 5 cardinal signs of acute inflammation. What do you mean by cardinal signs? Cardinal signs are the signs which occurs in all forms of acute inflammation. Now, acute inflammation can occur in any part of human body, starting from head. It can be meningitis, it can be encephalitis, it can be rhinitis, it can be endophthalmitis, it can be tonsillitis, it can be any part of the body can have acute inflammation. So, but if acute inflammation occurring in any part of the body, 5 things occurs in all that part of the body whenever there is a acute inflammation. That is known as cardinal feature. So again, let's take an example of tonsillitis only to understand it better. Okay, so whatever organ in which there is acute inflammation, that particular portion of the body becomes red in nature. Can you see the tonsils are red here? So it is known as redness, So the temperature of that portion is more as compared to the surrounding temperature. The temperature of that part which is inflamed, which is acute inflamed, that is more as compared to the surrounding part. That portion of the body is swelled as compared to the surrounding part. And there is pain. Whenever we have tonsillitis, there is pain in the tonsils, right? And there is temporary loss of function of that particular organ, temporary loss of function. So that is the 5 cardinal signs, but these are in English language, But in your exam, most of the questions, they ask in Latin language. So you have to, do you know Latin? I don't know Latin. So basically, you have to convert the English into the Latin. But we will learn these 5 cardinal signs in Latin language. Okay, so redness in Latin is known as rubor. So learn rubor. Increased temperature is known as calor. So learn calor. Have you heard the instrument calorimeter? The calorimeter is derived from calor only, the instrument which is used to measure the temperature. So it's calor. Swelling is known as tumor. Now don't get confused. This is not tumor of English. In English language, the tumor means malignancy, right? Neoplasia. But here tumor means just swelling. It is the Latin word. Pain means dolor. And temporary loss of function is known as Functio. So please learn it's rubor, calor, tumor, dolor, and Functio. These are the 5 cardinal signs of acute inflammation. Out of the 5, the first 4 are described by Celsius, and the last one is described by Virchow. So please learn the name of the persons or the scientists who described them first time. So that is the 5 cardinal signs of acute inflammation. Please learn. Rubor means redness. Calor means increased temperature, tumor means swelling, dolor means pain, and Functio means temporary loss of function. The 5 cardinal signs of acute inflammation, you can imagine any organ like tonsils while describing them. So it will be better or easy to retain. Okay, so now coming on acute inflammation events. We divide the acute inflammation events in 2 portions, the vascular events and cellular events. There are 5 vascular events and 6 cellular. In this way, there are total 11 events to be described. Total 11 events are there in acute inflammation. We have to describe the 11 events. Okay, so in this video, we will discuss the vascular events. So these are the 5 vascular events. I will be discussing them one by one. You can see the 5 vascular events. These are the 6 cellular events. Again, I will be discussing them one by one. So total 11 events are in front of you. All the 11 events I am going to discuss in this master diagram. It's very important to understand this diagram, to understand the basics, so that step by step, I'm going to discuss the 5 vascular and 6 cellular events in this master diagram. What is this diagram? Can you see in this diagram, I have drawn this yellow line. Can you appreciate this yellow line? I guess you all can appreciate. Just suppose this is the skin of any portion of the body. Just suppose this is this portion of the body. This is the skin. You all can see the skin. Okay, just below the skin, there is a blood vessel. All the portion of the body, just below the skin, we have blood vessel. So imagine this is the blood vessel. The blood vessel is lined by the endothelial lining. So you can see these are the endothelial cells. Appreciate the endothelial cells. See the nucleus of the cell. Okay, now inside the blood vessel, we have 3 types of cells, RBC, WBC, platelet. But currently, I am interested with WBC, not with RBC, not with platelet. So you can see I have drawn the green color cells. Can you see these are the green color cells? The green color cells here are the WBC I have drawn here. Okay, and can you see what I have drawn here? This is the infectious agent. I mean injurious agent. This is the injurious agent It can be physical injury, chemical injury, biological injury. In the biological injuries agent, it can be a bacteria, virus, fungus, parasite. It can be anything. It can be some inert material. So I will call it the injurious agent. Now we will understand all the events with the help of a story. So let me frame a story. So the injurious agent, I will call the injurious agent as a terrorist. The terrorist who is entering the country, who is a foreign material and who is causing harm to the country people. Okay. And who is the army? The army is the WBC. So instead of calling them WBC, I will call them as army. This is my army. So you can see the terrorist is entering and the army. So you will say, ma'am, what is the problem? Let's fight them. So let's see who is winning. Let's see. So the fight is known as phagocytosis. If the terrorist is winning, it will lead to infection. And if the army is winning, it will lead to inflammation. So, but there is a problem in this. What is the problem? Problem is that the terrorist, that is the injurious agent, is extravascular, and the army, that is the WBC, is intravascular. If they can't meet, how they can fight? For fighting, they should meet, but one is extravascular, one is intravascular. So how they will meet and how they will fight? That is the problem, right? Now there are two possibilities, you will say. Either take the injurious agent inside the blood vessel so that they can meet, they can fight. Is it a good idea? I don't think so. It's a bad idea. If you take the injurious agent just like bacteria inside it will lead to sepsis. The bacteria will infect all the organs, via blood it will reach and anywhere, the infectious organism. So it's not a good idea to take the infectious organism inside the blood vessel. But other way around, the second idea is good. Let's take WBC out. Yes, we will take the WBC out. So basically, I am going to teach you 11 events. The purpose is that to take the WBC out only. So first I will teach you 5 vascular. Then I will teach you 6 cellular. In this way, total I will be teaching you 11 events. The purpose or the goal of all 11 events is same, to take the WBC out of the blood vessels so that it can fight with the terrorist, it can fight with the injurious agent. So ultimately the phagocytosis will take place. Okay, so that is the event. I hope you got this master diagram. I hope you got the purpose and the story I am framing. So I will be discussing the 5 vascular events one by one. Let's start the first event. Can I start the first event? What is the first event? The first event is the transient vasoconstriction. Let's see here. Can you see, as soon as the injurious agent, the terrorist, is coming, the portion of the blood vessel just below the terrorist or in front of the terrorist, it undergo vasoconstriction. But this vasoconstriction is very transient. It's not persistent. It's hardly lasts for few seconds or maximum for few minutes. And it will lead to blanching. If you see from above, just suppose this is my skin. Just suppose just below the skin, there is injurious agent. So the blood vessel of this portion, it will undergo vasoconstriction. It's the focal vasoconstriction. Focal. It's not the complete blood vessel. Only this portion blood vessel undergo vasoconstriction. So this portion look, less blood is there. It is known as blanching. So the first step is the transient vasoconstriction. The word to be transient is important. It hardly lasts for few seconds or few minutes, and it results in blanching. That is the first step. What is the second step? The second step is the vasodilatation, which is persistent, which is progressive. Can you see this portion? This portion of the blood vessel undergo vasodilatation. This portion is vasodilated. So this portion, initially it was vasoconstricted, but it is transient. And now this portion undergo vasodilatation, which is persistent. It will be for next few hours, So it is persistent here. So that is step number 2. Now, if you see from above, just suppose this is the portion. This portion undergo vasodilatation. The blood vessel just below this portion undergo vasodilatation. So if I look from above, this portion looks red to me, And if I touch this, because it is having more blood, no? And if I touch this portion as compared to surrounding temperature, the temperature of this portion is more because of the more blood. So this portion is vasodilated. It has more blood. Since it is having more blood, this portion is having more blood. So if you look from above the skin, this portion look red and this portion look more hot. So Rubor and Calor is, explained here. I told you there are 5 cardinal signs. Out of the 5 cardinal signs, 2 of them we can explain with this step. Which step? That is vasodilatation. The persistent vasodilatation step number 2 is proving 2 of the cardinal signs, the Rubor and the Calor. That is my point. So you can see the Rubor and the Calor can be explained because of persistent vasodilatation. Because of the persistent vasodilatation, there is more blood. More blood leads to Rubor, more blood leads to Calor. So that is step number 2. Now coming on to step number 3. The step number 3 is increased hydrostatic pressure. To understand it, you must know the Starling's law. Have you read Starling's law in physiology? Let me help you in revision. There are two types of pressures acting on a blood vessel or a capillary. One is outward, one is inward. The outward pressure, you can see the arrows. The outward pressure is hydrostatic pressure. Hydro means water. It is the pressure due to water. It is always outward. Okay. And oncotic or osmotic pressure is inward. Look at the arrows. This is the pressure due to proteins. So whatever protein, especially albumin present in the world, in the blood vessel, it will drag the water inside. It will drag the water inside. So the pressure due to protein is known as oncotic pressure, and the pressure due to water is known as hydrostatic pressure. This is Starling's law. Can you see the Starling's law? Yes, this is Starling's law. Okay. Now you tell me, here vasodilatation is taking place. In vascular events, the vasodilatation is taking place. What will happen due to vasodilatation? Out of the two pressure, which pressure will change? The hydrostatic pressure or oncotic pressure? Hydrostatic pressure depends on water, and oncotic pressure depends on protein. So you yourself tell me by using your common sense. You tell me. So because of the vasodilatation, you can see there is more blood. Since there is more blood, there is more water in this portion. So this portion of the blood vessel have more blood. It is having more water. Since it is having more water, it is having increased hydrostatic pressure. So increased hydrostatic pressure means outward pressure is more. Can you see? Outward pressure is more, but inward is same. Inward is same. So there is the imbalance. Normally outward is equal to inward, so they cancel each other. Whatever outward, the same amount is inward. So they cancel each other. But here, this portion is vasodilated. Since it is vasodilated, there is more blood. More blood means more water. More water means increased hydrostatic pressure. Increased hydrostatic pressure means increased outward pressure, but inward pressure is same. So outward is more, inward is same. So there is an imbalance. Because of the imbalance, there is increased hydrostatic pressure. The fluid will come out in the next step. So this is increased hydrostatic pressure, the third step. So because of the imbalance, the fluid will come out. The fluid will come out and accumulate here. Let me accumulate the fluid here. It is known as edema. So this step is leading to edema, and because of edema, there is the swelling. Just suppose this is the portion, this portion will swell out. It will swell out because it is edema, extravascular collection of the fluid. Edema, it's transudate in nature. So transudation of the fluid to the extracellular space will lead to edema, right? And it is proving the third cardinal sign, that is tumor. So what I have taught you till now? Till now, we have studied the 3 out of the 5. We have studied the 3 vascular events. The first one is the vasoconstriction, which is transient in nature. Okay, and the second one is vasodilatation, which is persistent in nature. The transient vasoconstriction is only for few seconds. It leads to blanching. It leads to blanching. The persistent vasodilatation is persistent for next few hours. It leads to rubor. It leads to calor. Okay, and the third step, due to the vasodilatation, there is more blood, more water, more hydrostatic pressure. So third step is increased hydrostatic pressure. Due to increased hydrostatic pressure, the outward pressure is more, the inward is less. So there is an imbalance. Due to the imbalance, fluid leaks out. The fluid which is leaking out leads to edema. Edema is known as tumor. So here edema or tumor, the transudate type of edema or tumor is proven. So for proving rubor, step number 2 is responsible. For calor, step number 2 is responsible. For tumor, step number 3 is responsible. So these are the important questions from exam point of view. Okay, so let's move. So here also you can see the same diagram. Let's have a look on diagram number 1. Can you see there is a blood vessel? So can you see this is the endothelial lining of the blood vessel? Appreciate the endothelial lining. Can you see the arrows? This is outward hydrostatic pressure. This is inward colloid or oncotic pressure. The size of the arrow is equal. So outward is equal to equal. There is no edema. See the second diagram. The outward is more, the inward is less. The reason for increased outward is vasodilatation. This portion of the blood vessel undergo vasodilatation. More blood, more water. That's why outward pressure is more. But inward is same or less. It will lead to imbalance. Because of the imbalance, please appreciate these arrows. The fluid is leaking out. And after leaking, I hope you can appreciate the background. This bluish yellowish color. The fluid is accumulating in the background, leading to edema. So this is known as edema. It is known as tumor. This type of edema is known as transudate edema. So this is step number 3. Now coming on the most important step is step number 4. The name of the step number 4 is increased vascular permeability. This step is the hallmark of acute inflammation. I told you I'm going to teach you 5 vascular events and 6 cellular events. In this way, I will be teaching you 11 events, total 11 events. What is the hallmark step? The most important step, the hallmark step, the pathognomatic feature or pathognomatic step of all 11 steps. It is step number 4 of vascular event, that is increased vascular permeability. That is the most important step. What do you mean by that? The lining of the endothelium is by endothelial cells, the lining of the blood vessel. Normally it's continuous. There is no gaps in that. So creation of gaps is known as increased vascular permeability. The first thing you should understand the meaning. What is increased vascular permeability? The meaning of the increased vascular permeability is creation of gaps. The gaps are created. It is known as increased vascular permeability. So this is the hallmark feature. Now, if the gaps, can you appreciate these gaps? So initially gaps were not there. So only fluid was leaking out. Leading to transudate type of edema. Now, because of the gaps, along with the fluid, the protein will also leak out. Can you see the dot? This is all protein. So protein and cells are also leaking out. So in the edema, along with fluid, protein and cell is also present. Such edema is known as exudate edema. So here the edema will convert from transudate to exudate. So here basically the edema is exudate, and it also happens mostly in the venules. So it will exaggerate the tumor or the swelling. Let me summarize till now. I taught you 4 steps till now. The 4 steps. Out of the 5, the fourth I'm teaching you right now. So the first step is increase. The first step is the vasoconstriction, which is transient in nature. The second step is the vasodilatation, which is persistent in nature. The third step is what is the third step? Increased hydrostatic pressure. And the fourth step is increased vascular permeability. Let me tell you the consequences. The transient vasoconstriction, it's only transient, hardly for few seconds. It leads to blanching. Okay. Persistent vasodilatation is for next few hours. Due to vasodilatation, there is more blood, more water, and more blood, more water leads to increased hydrostatic pressure. So persistent vasodilatation, there is more blood leading to Rubor, leading to Calor. Increased hydrostatic pressure leads to edema. Increased vascular permeability means creation of gaps. It also leads to edema. But here only fluid comes out. That's why edema is transudate. Here along with fluid, the protein and the cells also come out. That's why edema is exudate. So please learn that for transudate edema, this step is responsible. And for exudate edema, this step is responsible. That is the ultra important thing. Now you may be thinking the reasons for the gap. There are 5 different mechanisms of gap formation. I will be discussing all 5 one by one. So let me tell you the 5 mechanisms. Before that, let's have a look on this diagram. You have already seen this diagram. Here the lining is continuous. Endothelial lining is continuous. See the pressure. Outward is equal to inward. See the second diagram. Here also the lining is continuous. The endothelial lining is continuous. But you can have a look on the arrows. The outward is more as compared to inward. Let's have a look on the third diagram. These are the endothelial cells. The endothelial cells are contracting. All the endothelial cells are contracting. So you can see the gaps are created in between. From these gaps, along with the fluid, the protein is also leaking out. So this type of edema is known as exudate type of edema. So this is increased increased hydrostatic pressure. This is increased vascular permeability. The increased vascular permeability is creation of the gaps. So here the edema was transudate, only fluid is there, right? Low protein, low cell, and here the edema is exudate, high protein, high cell along with the fluid. So that is the basic difference between them. So the same thing is written in front of you. For transudate type of edema, increased hydrostatic pressure is responsible. That is step number 3. And for exudate type of edema, increased vascular permeability is required. That is step number 4. Right. Now coming on the 5 mechanisms of increased vascular permeability or gap creation. So the 5 mechanisms are in front of you. We will be discussing them one by one. How the gaps are created. These are the 5 mechanisms. So the first mechanism here is formation of endothelial cell. Normally, can you see the endothelial cell? This is the endothelial cell. They're continuous with each other. There is no gap. I can't see the gaps. They're continuous with each other. But imagine this endothelial cell is contracting. This is also contracting. This is also contracting. This is also. So when all the endothelial cells will contract, so at their junctions, I'm using the word junctions. At their junctions, the gaps are created. So gaps are created at the junction due to endothelial cell contraction. So who is causing this contraction? The histamine. Histamine is a cytokine. So histamine is causing the contraction. It's very important question, right? and it is how long will it last? It will last only for few seconds. So again, for few seconds they will contract and again they will relax. So this one is transient and very short. It's transient and short lasting. So out of the 5 mechanisms which I am going to discuss for increased permeability or gap creation, the most common is the first one, due to the contraction of endothelial cell, and it is due to histamine. It basically occurs in the venules. It doesn't occur in the artery or capillary or the veins. Basically, it mainly occurs in venules. And this one is immediate and transient. Immediate means as soon as the infectious agent is coming, the same moment the endothelial cells are contracting. So onset is very fast and the duration is short. So onset is less, duration is less. It's immediate transient, right? So that is the thing. You can see the same diagram. You can see here the longitudinal diagram. Here the endothelial lining is continuous. See the next one. Here this cell contracts, this cell contracts, this cell contracts. At the junction, appreciate the gaps. Appreciate the gaps. Or if I cut this blood vessel and look the sideway, you can see the cross section also. Appreciate the cross section. In the cross section, this is a cell. You can see this is a cell. You can see. Now appreciate the junction. Appreciate this junction, this junction. At the junction, there is a gap. This is contracting. This is a contracting. At the junction, there is a gap. So this is the first mechanism. Coming on the second mechanism. In the second mechanism, now this is the endothelial lining. Now it's continuous. The endothelial cells are not contracting. So what is the next best way? Who will cause the gap creation? We want to create the gap. Otherwise, WBC will not go out. Creation of gap is most important for going WBC out. The ultimate purpose is to take the army out. How you will take the army out if you don't have the gap, right? So the second mechanism is the gap is created by the terrorist itself. So terrorist will create the tunnels or the gaps by causing the necrosis of the endothelial cell. It can be at the junction, it can be at the non-junction, and it will challenge the army. Please come out and fight with me. I have created gaps with you. So this is known as direct endothelial injury by the injurious agent. Can you see this is the injurious agent? Yes. This injurious agent is causing the necrosis of the blood vessel at various levels, creating gaps at multiple levels. So direct injury causing necrosis and detachment of the endothelial cells by toxins, infections can occur. Now this one is immediate but prolonged. So it occurs immediately. The onset is less, but the duration is more. And it occurs at all microcirculation level, not only at venules. Okay, so that is the thing. The same you can see here also. The injurious agent is creating the gaps. Now the point is that it can be at junction, it can be at non-junction. It is not necessarily at junction only like the previous case. Coming on the third mechanism. Now, in the third mechanism, this is the endothelial lining, which is continuous. Now, this time the endothelial cells are not contracting. So, by first mechanism, we cannot create the gaps. The terrorist is also very weak. I mean, the injurious agent is not very potent, very active. It is also not creating the gaps. Now, who will create the gaps to go out? The terrorist is not creating this time. Army will create the gaps. So WBC will come, they will create the gaps at the junction or at non-junction, and then they will move out after that. So this mechanism is known as leukocyte-mediated endothelial injury. Leukocyte is WBC, right? So here WBCs are creating the gap. This one is delayed and prolonged. I mean, it is delayed, the onset is more, onset is late, and the duration is also more. It also again mainly affects the venules. You can see here in this diagram, these are the WBC. The WBCs are creating the gap. They are causing the necrosis of the endothelial again at the junction or at the non-junction. But the beauty of this diagram, you can appreciate the WBCs. Can you appreciate the WBCs? Yes. So WBCs are creating the gap. The fourth mechanism is the transcytosis. Increased transcytosis. Now in this mechanism, no gaps are created. You will be thinking, ma'am, then how WBC will go out? If there is no gap, how WBC will go out? WBC will go out without gap. What do you mean by that? So WBC will enter the endothelial cell from this side. It will travel in the endothelial cell and exit the endothelial cell from this side. So cell within cell movement. What I am saying? Cell within cell movement. Cell within cell. So the WBC is going inside the endothelial cell through vesicles. So cell within cell is known as trans. Trans means within. And cell within cell is cytosis. That's why it's known as transcytosis. It is caused by histamine and VEGF. And again, it mainly occurs at the venules level, right? You can appreciate the vesicles. Here also you can appreciate the vesicles. So WBC will enter from this side and will exit from this side through vesicles. So cell within cell. And the last and the fifth mechanism is the new blood vessel formation, that is angiogenesis. So whenever there is the inflammation, there is a rule the new blood vessels are always formed at that site, and the new blood vessels are already leaky. There is no need to create gap in them. Can you see the diagram? Now you can see this is the endothelial cell. You can see this is the endothelial cell. This is the endothelial cell. And this one is also an endothelial cell. You can appreciate the 4 endothelial cells, right? Now, in the endothelial cell, see the nucleus of the endothelial cell, you can see the spindle formation. The nucleus is immature, it's dividing, it's spindle formation. It is an indication to show that it's the new blood vessel and it's already leaky. You can appreciate the gaps. There is no need to create the gaps. It's already leaky. The mechanism is the cytokine responsible for this is VEGF. So please appreciate the 5 mechanisms of increased vascular permeability. You can see the first mechanism is endothelial contraction. You can see at the junctions there is gap. So this endothelial cell is contracting, this is also contracting, both are contracting. At the junction there is a gap. The second mechanism, the terrorist, I mean to say the injurious agent is causing the direct injury to the endothelium, creating the gaps. So direct injury to the endothelium by the injurious agent. The third is the WBCs, leukocyte mediated endothelial cell injury and prediction of the gap. So here terrorist is creating the gaps, here army is creating the gap, and here the endothelial cells were contracting. The most common is the first one. And the fourth mechanism, no gap formation. So it is cell within cell movement known as increased transcytosis. You can appreciate the vesicles. So the WBC will enter from this side and it will exit from this side, cell within cell movement. And the last is the new blood vessel formation. You can appreciate this is the endothelial cell inside which appreciate the nucleus, the spindle formation. It's a new blood vessel. You can see the spindles. So since it is a new blood vessel, it's already leaky. So no need to form the gap. So the 5 mechanisms with the 5 cross-sectional diagrams are in front of you. Out of the 5, the first one is immediate transient. The onset is less, the duration is less. The second one is immediate prolonged. The onset is less, but duration is more. And the third one is prolonged. Delayed prolonged. The onset is more and duration is also more. So that is the 5 mechanisms. Again, the summary is in front of you of increased vascular permeability. So increased vascular permeability is step number 4. That is the hallmark of vascular events or total inflammation, acute inflammation. That step is the hallmark, creation of the gaps. So the 5 mechanisms are endothelial gap formation, direct endothelial injury by the terrorist, leukocyte mediated injury by the army, transcytosis and increased leaky new blood vessel formation. So only direct endothelial injury occurs at all levels. Otherwise, everyone is more common at the venules. Here you see immediate transient, onset is less, duration is less. Here onset is less, but duration is more. Here onset and duration is both is more. So please appreciate immediate transient, immediate prolonged, delayed prolonged. And see the pathogenesis. So endothelial contraction is caused by histamine. The direct injury is caused by the injurious agent. Leukocyte mediated injury is caused by WBC. Transcytosis is caused by histamine and VEGF. And new blood vessel, the angiogenesis is caused by VEGF. So this table is ultra important, the master table from exam point of view. So you can see. And the last and the 5th step is the slowing or the stasis of the blood. So it will increase the viscosity. Can you see? The fluid already leaked out, the protein already leaked out. Now only cells are remaining. So cells will accumulate. That is leading to stasis of the blood, slowing of the blood, leading to increased vascular permeability. Right? So we are done with the 5 mechanism. The 5 vascular events, mechanism of the vascular events, 5 steps. So the first, second, third, 4th, 5th. Can we revise it together? So the first event is vasoconstriction, which is transient in nature. The second is vasodilation, which is persistent in nature. The third is increased hydrostatic pressure. 4th is increased vascular permeability, that is formation of gaps. And 5th is stasis. So can you tell me the relevance of each of them? The vasoconstriction leads to blanching. Okay. Vasodilation leads to rubor and calor, redness and increased temperature. Increased hydrostatic pressure leads to tumor, that is edema. This also leads to tumor or edema. But here the tumor is transudate in nature and here the edema is exudate in nature because the gaps are formed. Now for the formation of the gaps, I told you per se the 5 mechanisms. You may be knowing the 5 mechanisms we have discussed, and the last one is the stasis. Stasis leads to increased viscosity. You want me to revise these 5 mechanisms again? So it's endothelial cell contraction, the most common, Second, the injury caused by the terrorist, that is direct injury. Third, the injury caused by the army, that is leukocyte-mediated injury. The fourth is the transcytosis, no gap formation, cell within cell. And last is angiogenesis, right? So we have seen the details of all these five. This is the summary of the vascular events. Now, is there an experiment to prove this? Yes. There is an experiment to prove this. The name of the experiment is triple response experiment. There is an experiment known as triple response experiment. It's the Lewis experiment. This is performed by Lewis. So what does the Lewis has done? Lewis has taken a sharp pointed object and give a stroke on the forearm. Let me imagine this is a sharp pointed object and I'm giving a stroke. I'm giving a stroke on the forearm. So as soon as the Lewis has given the stroke on the forearm, it's the injurious agent. Three things happens one by one. The first thing is the red line, right? The line is formed at that point. Then the surrounding area also become red. It is known as flare. And after that, the complete area swells up. The swelling is known as wheal. So that is, can you tell me the reason for this? So the Lewis has seen the changes in the skin on the inner aspect of the forearm when injury is given, the stroke is given from a blunt object. So it is triple response. Three things happen one by one. First is red line due to the vasodilatation of the capillaries in this portion. The second is the flare due to vasodilatation of the adjacent arterioles. And finally, the complete area swells up due to transudation of the fluid into the extravascular space. This is known as wheal, right? So you can see this is red line. You can see this is flare around the red line, and this complete area swells up. This is known as wheal. So this is triple response. We are done. Let's revise the 5 vascular events one by one in the master diagram. So these are the 5 vascular events: transient vasoconstriction, persistent vasodilatation, increased hydrostatic pressure, increased vascular permeability, stasis. So you can see this is the master diagram. We will perform the 5 steps one by one. The first is the vasoconstriction, which is transient. The second is the vasodilatation, which is persistent. The third is the increased hydrostatic pressure. Due to vasodilatation, more blood, more water, more hydrostatic pressure, there is an imbalance and the water leaks out, leading to transudate type of edema. The next step is the creation of the gap, which is known as increased vascular permeability, which is the hallmark step. From the blood vessel, the protein also leak out. There are 5 mechanisms. We have discussed the 5 mechanisms of creation of gaps. That is increased vascular permeability, the hallmark step. And the last step is slowing or stasis, okay, which is leading to increased viscosity.
Hello everyone. I hope you understood this topic with crystal clear concepts. Now, if you want the notes of this topic and all my YouTube session notes, then you can click on the link which is pinned in the comment box. Thank you so much for your kind attention, for your patience, for your valuable time. Now here a QR code is provided to you. You can scan it if you wish, and via scanning it, you can connect with me on various social media platforms like Instagram, Telegram, WhatsApp, where I share educational content which will be very useful for you. So if you wish, you can take the snapshot or you can scan it directly. And here is the contact number provided to you. You can save this contact number. It's 98330-32948. This is for WhatsApp support, chat support. It is not for calling. So if you have any doubt in the topic which I'm teaching you in this session, and if you have any doubt in other topics also, in pathology, pharmacology, microbiology, PSM, medicine, you can text your query here. And if you have any topic in your mind and you want me to take that topic, to schedule that topic in YouTube, so you can also text that topic here. So if many students are demanding the same topic, we will schedule it soon. So thank you so much. Wishing you all the best. Bye-bye.